Hi everyone, today discuss the understanding head pain, causes, types, and prevention. Head pain is one of the most common health problems faced by people all over the world. Almost every person at some point in life experiences pain in the head. Sometimes it is mild and goes away with rest, while other times it becomes so strong that it affects work, concentration and mood. To understand this condition properly, we must look at the causes, the different types, and the ways to prevent and control it naturally and medically. The brain itself does not feel pain because it has no pain nerves, but the structures around it such as blood vessels, muscles, nerves and the covering tissues can become irritated or inflamed, and that is what creates the sensation of pain. The message of pain travels from these tissues through nerves to the brain, where we feel it as a headache. The causes of head pain are many and can vary from simple daily habits to serious medical conditions. The most common reason is tension and stress. When a person works too much or faces emotional pressure, the neck and head muscles become tight. This tightness reduces blood flow and creates a dull pressing pain, often described as a band around the head. These are called tension headaches, and they are the most frequent type seen in adults. Another common cause is lack of sleep. The human brain needs proper rest to function correctly. When you stay awake for long hours or sleep in an uncomfortable position, the blood circulation in the head is disturbed and you wake up with a heavy feeling. Dehydration is another silent cause. When the body loses more water than it receives, the blood becomes thicker and blood vessels in the brain shrink, which triggers pain signals. That is why doctors always recommend drinking enough water throughout the day to keep the body hydrated. Eye strain is also a major factor. In modern times, people spend long hours in front of screens such as mobile phones, computers or televisions. The continuous focus on a bright screen makes the eye muscles work harder than normal. This strain extends to the forehead and temples, resulting in a headache that usually gets worse by the evening. If your job involves screen work, you must take a short break every 20 to 30 minutes and look at something far away to relax your eyes. Another important cause is blood pressure imbalance. High blood pressure increases pressure on the walls of arteries, including those supplying the brain. This pressure can cause throbbing pain, especially at the back of the head or near the neck. Low blood pressure can also create dizziness and mild pain due to insufficient oxygen supply to the brain. Regular monitoring and maintaining a healthy diet can help in balancing blood pressure. Migraines are a special type of head pain that are more severe and complex. A migraine usually affects one side of the head and comes with symptoms like nausea, vomiting, and sensitivity to light or sound. The exact cause of migraine is not fully understood, but experts believe it involves changes in brain chemicals like serotonin and abnormal widening or narrowing of blood vessels. Some people get migraines due to specific triggers such as stress, strong smells, certain foods, loud noise, or hormonal changes. Keeping a headache diary helps in identifying what triggers your migraine so you can avoid it. Sinus problems are another reason for head pain. The sinuses are air-filled spaces inside the skull that help humidify the air we breathe. When they get infected or blocked due to cold or allergy, the pressure builds up and causes pain in the forehead, cheeks, and around the eyes. Sinus headaches usually come with symptoms like nasal congestion and facial tenderness. There are also cluster headaches, which come in groups or clusters. They are extremely painful and occur on one side of the head, usually around the eye. The cause may be related to abnormalities in the hypothalamus, which controls body rhythms. These attacks can last for weeks or months and then disappear for a long period. Sometimes head pain may be a warning sign of something more serious, such as infection, meningitis, brain tumor, or bleeding inside the brain. These cases are rare but require immediate medical attention, especially if the pain is sudden and severe or accompanied by symptoms like vision problems, weakness, or confusion. Preventing head pain is possible in most cases by adopting simple healthy habits. The first and most effective step is managing stress. Practicing relaxation techniques such as deep breathing, meditation, or yoga can relax the mind and body. Exercise improves blood flow and releases endorphins, which are natural pain relievers produced by the body. A balanced diet plays a crucial role. Avoiding excessive caffeine, sugar, and processed food helps maintain stable energy levels. Eating more fruits, vegetables, and whole grains provides essential nutrients that strengthen the nervous system. Regular meals and adequate hydration prevent fluctuations in blood sugar and water levels which can otherwise lead to pain. Proper sleep is essential. Adults should sleep at least 7 to 8 hours every night. Maintaining a regular sleep schedule and creating a calm sleeping environment can prevent morning headaches. Using a comfortable pillow and keeping the neck aligned also reduces muscle strain. For people who work long hours on digital devices, using the 20-20-20 rule can help, which means every 20 minutes look at something 20 feet away for 20 seconds. Adjust screen brightness and posture to reduce pressure on the eyes and neck. Medical treatment depends on the cause. Mild headaches can often be relieved by rest, hydration, and over-the-counter pain relievers like paracetamol or ibuprofen, but frequent use of such medicines is not recommended as it may lead to rebound headaches. If headaches occur more than 15 days a month or increase in intensity, then a doctor should be consulted for a proper diagnosis. In some cases, doctors may prescribe preventive medications, especially for migraines. Physiotherapy can also be beneficial if the pain comes from muscle stiffness. For sinus-related pain, steam inhalation and decongestants may be advised. Along with medical care, lifestyle correction is key. Reducing alcohol and smoking intake is essential because both can trigger or worsen headaches. Keeping a diary to note the timing, intensity, and possible triggers of pain helps in understanding the pattern. Lastly, mental attitude matters a lot. A calm and positive mind is less likely to develop stress-induced pain. Learning to let go of worries and focusing on things you can control improves overall mental health and indirectly protects from head pain. In conclusion, head pain is not just a physical issue but often a reflection of the body's response to stress, lack of rest, or unhealthy habits. Understanding the root cause helps in preventing it naturally and effectively. If managed properly through balanced lifestyle habits and timely medical advice, one can live a healthy and pain-free life. Remember, your head carries your thoughts, dreams, and creativity, so take care of it every day with love, rest, and proper care.